Preventing food allergies. Part 1. What is a food allergy and how can families help prevent it? Wouldn't it be nice if babies came with operating instructions? With so many details to think about, it's easy to feel overwhelmed. For instance, you may be concerned about food allergies. Over the past few decades, there has been a big rise in the number of children who have them. The most common foods children are allergic to, known as food allergens, are peanuts, eggs, cow's milk products, including yogurt and cheese, tree nuts, sesame seeds, fish, shellfish, wheat, and soy. However, sometimes other foods can cause an allergic reaction too, so it helps to know the signs. Bear in mind that most reactions in infants are mild. What can an allergic reaction look like? Since your baby can't tell you what they are feeling with words, you should be aware of the signs that they may be allergic to a food. A quickly appearing rash like hives, a raised rash that may be itchy, a change in their behavior soon after eating, like suddenly becoming fussy or vomiting, coughing, sneezing, or a sudden increase in drooling can also occur in combination with other symptoms. If one or more of these signs occur soon after adding a new food, stop feeding your infant, watch them, and if you have any concerns, call your healthcare team. Babies rarely have a severe reaction, but if they do, it may look something like this: hives spreading to cover the entire body, significant swelling of the lips, face, or tongue, perhaps some difficulty breathing or repetitive vomiting, diarrhea, repetitive coughing, changes in skin color, sudden tiredness, or going limp. If you notice any of these more serious signs of an allergic reaction, get immediate medical care. Call 911. This may sound scary, but again, severe reactions in young babies are not common. What is really important for you to know is that you and your family can actually help prevent food allergies from developing in your child. So while we may not have a baby operating manual, there are some useful instructions we can offer when it comes to food allergies. Offering baby-friendly forms of the common food allergens to your baby early and continuing to offer these foods to them regularly as they get older can lower their risk of developing a food allergy later in life. Guidelines recommend offering common food allergens to infants around 6 months and even as early as 4 to 6 months if they are developmentally ready to eat. Offering these allergens early and then keeping them in the diet can help reduce the risk of developing a food allergy. Likewise, delaying introductions may increase the risk of developing a food allergy. Based on current research, the Dietary Guidelines for Americans provide recommendations for when to introduce solids to babies to prevent food allergies. Before we jump into more details, let's go back to the very beginning in our next video: what to think about in the first several months.